Morning, everyone. My name is Ewan Maule. I'm a clinical director with responsibility for medicines and pharmacy, which isn't terribly related to what we're talking about today. But I work for the North East and North Cumbria Integrated Care Board. Don't worry, I'll explain in a minute what that is, because most people don't have a clue what that is. But I'm also the co-chair of the Prevention Board as part of the Healthier and Fairer agenda. So I co-chair that with Alice Wiseman, the Director of Public Health for Newcastle and Gateshead. So thanks everyone for coming along today. It's a really, really interesting agenda. I'm assuming everyone in here is here for the Treating Tobacco Dependency event. If not, you're welcome to stay. It'll be very interesting anyway. We've always got to do the housekeeping. So we're not expecting any fire alarms. If there are, there's a big green sign over the door at the back, so I assume you just make your way out there. The toilets, people will probably have found them through the restaurant on the first floor. If I can ask you to keep your phones on silent, everyone has their phones on silent anyway these days, don't they? Whoever hears a ringtone these days. We do positively encourage you to use social media, and we've got some hashtags there if you want to do it. Please, if you're going to take a photo of me up here, please give me a bit of heads up so I can do the right face for it. There is some video recording going on of the event. The presentations are being recorded. If anyone doesn't want to appear in any of those, then please kind of make yourself known. And I think there's interviews with people as well for sort of Vox Pop social media type things, so I'm sure a lot of people get asked to be involved in that. We've got some selfie boards. I always sound like such an old man when I say the word selfie, but there are selfie boards floating around. I think are they up at the back, so presumably during the breaks people will be encouraged to use those. What we're going to do is we've got a series of presentations coming up, and then we've got a panel session at the end. So rather than taking questions after each individual presentation, we'll save all of them at the end, and we've got the boy band stools here and roving mics for when we do the panel session in the Q&A. And there are workshops, so you can register with those and see the registration desk at break times. Now, what would an event be without a Mentimeter? We've got to have one of these, so please scan that with your phone. I think the question on there is about what you hope to get from today. So if you could please do that and give us an idea, because that helps obviously the planners of the event look back at the end and did we deliver, did we encourage people to come for the right reasons, but did they get what they were expecting out of it? And obviously with future events that helps with some planning. So if people can scan that would be very helpful, and put your thoughts in there. I'm not going to move on until everyone's had a chance to scan it. Okay, so I was invited along to give the welcome address, which sounds very posh and very important. In reality, I'm probably not going to tell you anything that you don't already know, because I suspect everyone who's already in this room is already working fairly closely in this agenda. So you probably know all this kind of stuff already. So the bit that you might not know is what on earth is an integrated care board, and how's that different from an integrated care system, and what on earth is an integrated care partnership? To be honest, I struggle with some of those things myself, but I'll try and explain it as simply as I can. So the North East and North Cumbria is the largest integrated care board in England. So we've got responsibility for over 3 million people, and we've got 11 foundation trusts, including the ambulance service in our patch. Now, the integrated care board, the simplest way to put it, the integrated care board is the actual kind of NHS organisation that employs me. And broadly speaking, what that does is it gets all the money for pretty much all of healthcare for that 3 million plus population, and we spend it on behalf of our population. So that's really what we're about. We're about getting the money, spending it, getting the best value for that money for our population. So we make decisions, what do we invest in, what do we not invest in? Is the stuff that we're investing in good enough? Is it delivering what we need, is it not? So the vast majority of the money that goes to those trusts, as well as a huge number of other services, all your general practice, pharmacy, optometry, dentistry, all that kind of stuff, all that money flows through us. So that's our kind of responsibility as an integrated care board. And we're a £7.5 billion organisation. So that's an awful lot of money that we spend on behalf of our population on NHS services. And that bit about NHS services is a really important thing I'm going to come back to in it. The integrated care system is not an NHS organisation, not a single NHS organisation, but it's basically when you get all the NHS organisations together and all the bits that provide NHS services, that's the integrated care system. So that's broader than just the board part of it. And then you've got the Integrated Care Partnership, which is all of the ICS stuff, plus local authority, voluntary sector, and all those kind of things. So the Integrated Care Partnership basically is the bit that says, strategically, this is what we want to do for our population. And then the Integrated Care Board and the Integrated Care System kind of do that, deliver that. So that's broadly speaking what it is. You can see up there, obviously, the geography of our integrated care system. It's absolutely huge, and it's very, very diverse as well. So we've got the big urban centres, Newcastle, Sunderland, Middlesbrough and things, and then we've got huge rural areas, Northumberland, the parts of the Lake District, Durham Dales, all that sort of stuff. And we've got some really affluent areas, and we've got some really deprived areas in that. So it's challenging to see our population as a population, because it's actually hundreds and thousands of populations and communities within that. So what the Integrated Care Partnership, we've got four sort of aims of that, 4 priorities in that. So we want our population to live longer and healthier lives. We want to have fairer outcomes for all. We want to have better services. And we want to give children and young people the best start in life. Now, obviously, if you're looking at it from a tobacco lens, you can see tobacco running through all 4 of those very, very clearly. So this is something that's absolutely at the heart of what the Integrated Care Partnership and then the ICS and the ICB are seeking to do. So the case for tobacco, it's not the case for tobacco, by the way, it's not a sales pitch for tobacco, it's actually the opposite. So we know that tobacco is still the biggest driver of health inequalities, and given that health inequalities is one of the most important things that we are set up to look at, it means it's a really high priority for us. So it's the single biggest thing that separates the most affluent from the most deprived populations. And that's really, really key to us, because we know that we've seen health inequalities widening over the last particularly 20 years. So this is an agenda we've really got to get on top of. And the single biggest cause of preventable death and illness. So if you look at that £7.5 billion that we spend on health and on health services across our region, there's a really strong case to say the single biggest thing we could do to make an impact on using that money effectively is sort this out. So it's a really, really high priority. And we also have to recognise that it's a clinical condition, and I think we haven't necessarily always recognised that. And that's been part of one of the things I want to briefly mention is to what extent the NHS plays a role in public health. Because to a certain extent, we've kind of gone, well, the NHS is like the bucket that you fall into when you're poorly, and we fix you up and patch you up and then send you out again. And actually, that's not really sustainable for the NHS to keep doing that. So we know that we've got to treat it as a clinical condition. We know we've got to do more than we're doing. And people might be familiar with the Core 20 plus 5 concept. So this is a national concept, and it's Core 20 is the 20 most deprived 20% of the most deprived population in England, and the plus 5 are these 5 clinical areas. So you can see there, they're all very directly impacted by smoking, and you can see the figures there about our ICB as well. So 12% of women still smoking at the time of delivery. I mean, that's really unacceptable. And the deprivation, the difference in deprivation from affluence in that is really quite stark. 42% of people with serious mental illness smoke, so there's a huge inequality in that. And you can see the same chronic respiratory, early cancer diagnosis, hypertension. It's a thread that runs absolutely through all of this. Now, smoking in our region has fallen, and we've done really, really well in the past with getting smoking in our region to fall. But the fall in smoking has not been universal. So it's not been across every population. There's, again, widening discrepancies, widening health inequalities between the most deprived and the least deprived populations. So you can see there that that's just highlighting the obvious links with poorer outcomes compared to other areas in the country. So, as I say, it's really important the NHS doesn't step back and say, well, smoking is a public health problem, it's not our problem, we'll just fix people up when bad things happen to them as a result of smoking. But actually, we can't, purely on an economic basis, we can't keep doing that, because it will bankrupt us and we'll not be able to provide NHS services anymore. So the smoking costs for our ICB, £2.65 billion. I mean, that's a very, very big number. It's a very big number. And the burden of tobacco dependency on our healthcare services. So 1 in 4 patients in hospital beds are smoking, 35% more GP appointments for smokers than non-smokers. There is something really, really strong and really powerful we can do in this. And it's also extremely cost effective. So actually, as an argument about investing, there are not many things you can do that will have that sort of a return on investment. So it's quite a strong case to make to say, actually, if we invest in this, we'll save an awful lot of money. Now, the difficult bit in the past has been the partnership working. Partnership working is always really difficult. You know, my budget versus your budget, my politics versus your politics, my ego versus your ego, all that kind of stuff has been really difficult in the past. And actually what we need to do is put a lot of that stuff aside and just say, this is the right thing to do for our population. How can we collectively do it? And part of hopefully some of what we hear today will be some really good presentations on how some of that partnership working has happened, some really important case studies of where success has been, but also some challenges to us all in the system of why is this good stuff not happening everywhere? Why is it not happening universally? And one of the things I'm really interested in is, what is the NHS role in this? How can we further push at this? How can we support? Like it or not, the NHS has got a really important and powerful voice when it comes to influencing policymakers, MPs, people like that. People listen to the NHS because we're kind of this sacred cow. We're this sort of golden shining, you know, nobody was clapping for local authorities during the pandemic, were they? So we do have a role to play in this. So I think that's something that we need to pick up and we need to be stronger on. That's one of the things that I'm really interested in hearing and learning from today. So the Integrated Care Board is making kind of fresh commitments to this, and we do recognise that we need to make this more sustainable, more part of kind of business as usual for us, and provide a kind of a longer term stability and vision for this sort of stuff. So we're working towards that, and we know the Fresh programme, which Elsa's going to talk about later on, is absolutely fantastic and done tremendous things. So we need to work on how we support that across our whole system. So I'm really looking forward to hearing everyone's presentations today, and I really look forward to some of the conversation in the Q&A in the panel session later on as well. So I think, now Jim's not in the room, but we do have a video from Jim Mackey, the Chief Executive of Newcastle Hospitals. If I just press this button, will it play? You'll play it, right, okay.
Hi everyone, I'm Jim Mackey, Chief Executive of Newcastle Hospitals, and I just wanted to say a few words in support of the smoke-free work across the North East. So first of all, the stats are just really powerful and very compelling about the impact of tobacco dependency. And we know that not just that's not an issue just everywhere, but especially in our local population, and also that it really hits the most deprived parts of our population most hard. So we've got a lot of local, really strong reasons to try and take this seriously. And if we are really bothered, as we are, and we all say we are, about inequalities, about prevention, about trying to get upstream and really looking after people appropriately, this has got to be a key part of our work. So whether that's more structured, data-driven work around inequalities, making organisations better smoke-free environments, making every contact count in our individual clinical interactions. This is really important work that will save lives in the future if we get it right. So I'd urge you to contribute, get involved, but also challenge your organisations, people like me, to make sure we're doing all of the things that we can and should be doing to support this important work. Thanks very much.
Excellent, thank you. Now, I think that is the link to the Mentimeter, which apparently didn't work first time round. So if you want to have another go at that, that would be really helpful, thank you. I think just while people are doing that, it's really interesting what Jim says there about he encourages you to challenge people like him. And I think actually, knowing Jim, I think he really means that. I think he genuinely wants to hear from people about, actually, we're not as good as we should be at this sort of thing. And huge institutions like Newcastle Hospitals can be really powerful in doing this, both what they do within their organisation, but how they influence the wider population as well. So I genuinely would encourage people to do it. I think he would like to hear from people.